Morning everyone, welcome to our update on the state of COVID-19 disease in the Murrumbidgee Local Health District. It really is a day of good news. No new cases in the Murrumbidgee once again. And also an update about the situation in Shepparton. Now, you will remember that there were 3 cases of COVID-19 identified, and we've done close to 8,000 additional tests, and as far as we're aware this morning, none of those tests have come back positive. So it really is a testament to the community of Shepparton, who's obviously followed the rules in terms of social distancing, mask wearing and hand hygiene, that they've managed to control that outbreak very effectively. There's been a significant testing that's conducted by the Murrumbidgee Local Health District in some of the border towns, and we've done in excess of 150 COVID tests, which have all come back as negative. Now, it's obviously a big week for everyone in Year 12, and firstly, the Murrumbidgee Local Health District would like to wish all our students all the best for the HSC. When they present for their exam, they'll be asked if they have any flu-like symptoms, and obviously if you have flu-like symptoms, you will not be able to enter the exam venue. But what we've done as the Murrumbidgee Local Health District is that if you're an HSC candidate and you have any symptoms, contact the COVID hotline and your test will be prioritised, because once again we want you to do your exam, be successful and go to uni next year. So if you do ring, please mention that you're obviously with your HSC exams, that we will prioritise your test and get your result back as soon as possible. So that's the only update from me. Any questions?
Just on the testing, please, Len, did people in our region also respond? You mentioned 150, were they mostly Tobin Moor and Dandenong?
Well, so that was mostly the border areas, but our testing numbers here have gone up as well. So I do think that the community has done extremely well in terms of presenting for testing. But I must say we're very pleased that we haven't identified any new cases despite 8,000 additional tests, which has been a massive effort by our Victorian colleagues.
Is it safe to say that Shepparton is in the COVID clear with community transmissions, or that there still be some lingering cases and that depends on testing?
So we've still got a few more days to go, after the 14 days when those cases were identified. So I think the most important thing is for people to follow all those rules. They still have to wear masks and hygiene, and obviously practice social distancing as much as you can. But currently still, if you've been to one of those areas in the last 14 days, you will not be able to visit a healthcare facility or residential aged care facility.
And also the border bubble is still a big focus, both regionally and more metropolitan areas. What sort of role does the MLHD play in reporting what's happening here to the Premier, and how much does that sort of get taken on board when looking at restrictions and things like that?
We obviously present all our data and information, and the LHD is in regular communication with New South Wales Health. Our public health unit have regular meetings with the Chief Medical Officer, so they'd be well aware of the state of play in Murrumbidgee, and we have been very, very well supported from New South Wales Health to make sure that we can look after our community appropriately. I think the most important thing for people is to really do the right thing, and as I said before, when you visit a venue, make sure that your details are recorded, because we still believe the biggest risk would be enclosed spaces if people are indoors, restaurants or other gatherings. So if we have your information, we can contact you. If we don't have your information, unless you find that information somewhere else, it really is difficult, and it then delays the time for contact tracing, and it makes it a lot more labour intensive for the people doing it.
Just some ease restrictions from this Friday, 30 people allowed to dine in at restaurants and whatnot. What's the message for those people, particularly locally, who might be thinking, we have haven't had a COVID case for quite some time, we might be in the clear. What's your message to those people who might have that idea coming into this weekend?
Well, I think we're obviously very pleased to have done so well so that we're in a position to relax the restrictions. As I've said many times before, we're very well aware of the impact it has had on the community, so we're very pleased and excited that we can enjoy more freedom. It's obviously good for local businesses as well. I think the most important thing is that if you're unwell, please don't go to the restaurant on Friday. Go and get a COVID test. And then when you are at the restaurant, make sure they've got a COVID safe plan, make sure that your details are there, and then behave responsibly. Okay, it really is to your benefit, and there's significant penalties for venues if they don't follow the COVID safe plan. So we don't want to be in a position where we have to take a step backwards. And we've seen now what's happened in Europe, where they're really going back to where they were 6-7 months ago, and we don't want to be in a position like that. And once again, the community has done so well, so we really want to continue doing that and to make sure that we can all enjoy and go out for a meal over the weekend.